And the way you can submit a question to any or all of the dentists is just to write in the chat through Zoom. And like I said, once we get through these questions, then Dr. Ortiz will begin leading this meeting sort of by going through the questions and sort of picking different ones for this panel to respond to. So to all of our guest speakers tonight, thank you so much for being here. These are trying times, and we really do appreciate you making time for this. By default, your microphone and video camera or webcam are muted. So through the Zoom application, when you answer a question, please be sure to unmute yourself. That way we can hear what you have to say. And then once you're done, you can just click mute again. That way Zoom doesn't bug out trying to figure out who to show to everybody in the meeting. So if you have any questions about how this is going to run, please feel free to drop those in the chat as well. And with no further ado, Dr. Ortiz, if you can unmute yourself, can you tell us what your name is and where you're from?
Hello?
Hey, we can hear you, but we can't see you yet.
Let me. How about now?
Perfect.
Can you see me? Okay. So, hi to everyone. It's I'm pretty happy listening to all of you, how you coping and hanging with that. On my part, myself, I also have a fellow UT student at home, and so he's doing good. He's working hard. So it's really strange that we invited him for dinner. I say, oh, I can't have an 8 o'clock test tonight. Oh, okay, that's how college is. So. Again, my name is Luis Ortiz Quiles. I am originally from Puerto Rico. I've been practicing dentistry for, wow, almost 27 years. I graduated in 1993, and time really flies. And I have to be honest, at the beginning, I didn't love this profession. I didn't know why I was doing this in dental school. But I stick around and I discovered that this is a beautiful profession that has so many opportunities to grow and develop. So I have work in any setting. So I'm here to answer questions to be a resource for all of you, and if not, so I will help you find the answer or the answers. And we have a nice group of colleagues, the Texas Academy of General Dentistry. So we are the Austin component, which I am the president supposedly until tomorrow, but I have to extend for a couple of weeks. And they are a great group that are willing to help. And they will be happy to having all of you shadowing on their offices. So I'm ready for any questions. So I'm gonna be here.
Awesome, thank you so much. I know that Dr. Mateo is in our meeting right now. Dr. Mateo, would you care to introduce yourself?
Sure. Can you hear me?
Yes.
Sweet. All right, so yeah, I'm Jeff Mateo. Should I just go through the list? I don't know if I can hear you anymore. I don't think I can hear you anymore, Bennett.
Bennett, you muted.
Thank you. We can start with just the first question if you want. And then once we know who all is in the meeting tonight, then we can go through the rest of the questions if that works for you.
Yeah, that's perfect. All right, so I'm from, I grew up in Bay Area, California. I kind of lived all over. I was born in Toronto, Canada. Went to school in Boston for dental school at Tufts. I'm actually, Dr. Tran, he and I are classmates. And we graduated at the same time, 2016. And then I did a 1-year AEGD after that. And that got done in 2017. I've been practicing since.
Awesome. Thank you for the intro. Dr. Tran?
Hey, what's up, guys? Andy Tran,
Also born in the Bay with Jeff Mateo. Went to Tufts for dental school. Been practicing since 2016.
Awesome. Thank you so much for being here. I know we have at least one or two more dentists that I don't have on our speaking list right now. So if we haven't heard from you yet, if you could just introduce yourself, that'd be great.
Ann Lyon, can you hear me?
Yes.
Hi. I just want to thank you for putting this all together, and I'm just really impressed how quickly and well you did it. I am a dentist, general dentist in South Austin, and as Louise said, all of us that are on this committee are wanting to have you into our offices as soon as possible, because we have space for you to do your shadowing. And this is not a really fun time right now, but things are going to be okay. Oh, I'm sorry. I don't have my computer thing doesn't work. I don't have a video, and you're lucky. Let me just tell you. So that's the little thing says the co-host has asked you to start your video. Well, my camera doesn't work. So anyway,
no worries.
That's okay. So I started as a music major. That lasted about a year in college. Then went to dental hygiene school. That was a 2-year associate program. Let me tell you, that's how it all happened. So dentistry has been a part of my life for a really long time. I went to dental school at the university. I'm sorry, went to undergrad at Michigan, and then also at the University of Houston, and then went to dental school at the University of Texas at Houston. Was an associate for 5 years, and then moved to Austin, bought a practice, and I'm currently a single owner practice in general dentistry, and I actually have 2 part-time associates. So life is good. You know, you guys are picking a really, really great profession.
I'll go next. Madison. Let's see, I'm from Kansas City originally, and that's where I went to dental school at UMKC, which now I think that there is a second dental school in Missouri. But of the tri-state area between Kansas, Missouri, and Arkansas, UMKC used to be all that we had. I've been practicing for 7 years now, and that's been between military, public health, Medicaid, corporate practice, and private practice. I'm trying to read these questions to kind of give you more information, but one thing that I think is important to tell you, and you're probably going to forget about this, is whenever you start being a dentist, you go into full-time practice, it's going to be exhausting, number one. And you may second guess why you did what you did in your career choice. I will say I kind of thought that I wanted to do this ever since I was like 5 years old. And it seemed so carefree. Everybody was having fun in the office. They were always playing music. And what, I really find out in actuality is it's a pretty stressful job sometimes. Some days way more than others, and some days it's a total breeze. And correct me if I'm wrong, but I kind of feel like sometimes you don't have your perfect staff to where it goes really easy breezy until, you're 20 years into your career and, you've went through a lot. I know that management just is a huge part of your daily workload, really. And I would say just the first few years getting out into practice, you don't realize how much you do not know. And it was stressful and discouraging almost to not be confident about everything all at, first. And that's something that passes. But for me, it took about 2 years for me to really feel comfortable with everything and to really love what I was doing. But I just thought that I would let you know that, because nobody really ever told me that that was sometimes a learning curve, and some like emotions that we go through as soon as we graduate. And you might forget that, but just so that I said it, wanted to let you know.
Thank you so much for that intro. Do we have any other dentists in the Zoom call right now that we haven't heard from yet? Okay, in that case, if there are any TPS members who have just joined, we have a few different dentists in our Zoom call tonight. And what we're gonna do is go through this list of basic questions and hear each dentist's response to each question. Then we'll move on to the next one. That way we can sort of get a comparison between each person. Once we've gone through these 7 questions, we're gonna take a bunch of member questions through the Zoom chat, and Dr. Ortiz will be selecting some of them to field to the panel. So without further ado, if we can start going through these questions, Dr. Ortiz, how would you respond to number 2?
So hi again. What surprised me about my job as a general dentistry is, as a general dentist, is that you don't realize that being a dentist, it's you are what I call a jack of all trades, a master of none. So you have to deal with so many things, so different things every time. You're not only a clinician, a dentist, you're a manager, you're a psychologist, you are a leader, a cheerleader, you are sometimes you have to provide inspiration. And yesterday I was listening to a seminar, so things to do besides dentistry as second opportunities. So, and it was very interesting about this guy that says that in the business world, in the leadership world, in outside dentistry, so we are qualified to do anything we want. So we probably we don't know, and we never realize that we have all the qualities and capabilities to be successful in any venture that we decide to do. So that's surprised me the most about being a dentist.
Amazing. And just going down the speaker list on this doc here, Dr. Mateo.
Hey, yeah, sure. I guess I'd say I didn't realize it would be so physically demanding, actually. A lot of almost manual labor, I guess. I mean, it's fun, but at the same time, at the end of the day, you're doing a lot of work. It's not just mentally and emotionally taxing, it's physically as well. And so I think that's something to be aware of. Make sure you're healthy and you eventually start getting like aches and pains and stuff over time. And I've just started my career, but that's something that surprised me.
Thank you for sharing that. Dr. Tran.
I think the thing that surprises me most about being a general dentist is all the things that you can do. You don't have to do anything you don't want to. You can just refer it out to a specialist. So it gives you a lot of opportunity. You can be a dentist, you can be a business owner, you can do both. It's a lot of flexibility and a lot of whatever you want. So it gives us a lot of opportunities to choose what we do, what we want to do, pick our strengths and work at those. And everything else will usually work out.
So I would like to just echo everything that everybody has already said. Those are all very important parts. And I guess the other thing too is that as dentistry evolves, it's not just about teeth. It's not just about the mouth, and it's about the whole body. And as we're going through this whole crisis, we just have to be mindful, like Jeff said, about stay healthy, stay away from people, and do those things that we need to do to be able to get back into being able to help our patients. And I think that's the biggest thing, is that how important that is to us, is to be able to help someone with a smile or with a pain or whatever. And so that kind of got me over the years. I said, geez, this is kind of impactful. And I really, when I got into dentistry, I just thought, oh, this is gonna be good. This is gonna be fun. And it turns out to be actually a wonderful profession.
I would probably echo everybody as well, especially the physically demanding part. Usually by Wednesday, if you're working Monday, Tuesday, Wednesday, you're feeling the mid backache by then. So ergonomics are really important, but you're going to have those patients where you have to make accommodations for because of maybe some of their physical barriers or what you need to see. You know, how difficult they are or their medical history too. So I think that that's probably the major one for me, but.
Thank you guys so much for sharing your thoughts on that. So our next question is, if you could have done anything or something different on your path to becoming a dentist, what would it be? Dr. Ortiz?
Well, I was thinking on that, and I would have said that I would have put more attention on my first year of my second 2 years of dental school. I think you have to keep a balance, and I think I party a little too hard, and so it's my nature, and play sports and be too social. So yes, I did. My philosophy back then was doesn't matter. I'm going to graduate. That's what I want. But I realized that when I decided to probably apply to graduate school, so that was a big hole that I have to recover from. So I have no regrets. I have fun, and I think I have a great life in dental school. But I should have a little more balance towards academia, which I'm doing now.
All right. So for me, I guess one thing that I think I thought about for a while was I actually took a year off in between college and dental school. And the reason I ended up having to do that was because I took the DAT late. So I didn't take it till my 4th year in college. So part of me kind of wishes I just figured it out sooner that I wanted to be a dentist. I was between a bunch of different career paths, and I didn't pick until my 4th year. That's something I used to think about. I think at the end of the day, it worked out, but I guess that's kind of a fun thing.
Awesome. And Dr. Tran, what do you think?
I think during that time, I guess I could have looked into being like a YouTube sensation or star. To be honest, I think I would just want it to be open in my office a lot sooner. There's a lot of scary things to do and to be and to learn, but if I could have done it sooner, I would have been in a better place a lot faster. And so don't, I guess it's more of a mindset. Like, if the bank's going to give you money, just take it and use it, because they're probably going to have all of their eggs in order, and you just need to get over that hump.
So I just want to put a little heads up. Dr. Tran has a fabulous brand new office. And the people that are on this call are extraordinarily different and are giving you great perspectives. But everybody that are actually sharing some really good things are in really good places right now, regardless of whether it's been 1 year, 5 years, 20 or 30 years. So this is really kind of a really great information for you guys. So the question about what I would have done differently, I think I was okay. I decided I had boyfriends, and then got married, but that was later on, had kids later, and I chose to do that so I could get through dental school, and I worked the whole time. So the work ethic has always been there. I don't see any change. I feel like everything kind of happened as it did, all because of hard work and perseverance. Bottom line, that's it. And if you want to be in general dentistry, then you're going to have fun, because you don't have to go for the all A's to try to be a specialist and get into specialty school. That was me. That's why I enjoy dental school so much, is because I knew that I wasn't going to have to worry about getting into ortho or getting into oral surgery. I was going to be a general dentist because of the thing that Louise said, we get to do everything or anything, or well, maybe it was Andy, but do what we want or not. So it's a great option to have. And so I don't know that I would have done anything differently.
Awesome.
Okay. There's a lot of stuff that if you think back and you could really give yourself some advice way back then, I would definitely give to you. So number one, when you're in dental school, I recommend trying as much of everything as you can. Take full advantage of all the time that you have in clinic. Do as many procedures, try as many new things that you're not comfortable with, because it's so much better trying them in that environment than on your patient when you're on your own and you do not have the materials. And then that way you can really decide for yourself, is this something I want to implement into my practice and invest in? Because all those things cost a ton of money when you get out. So take full advantage of that time. If there's any extras that you could at all, do. Another thing is it would prepare you as well to go into private practice or be solo. There's a lot of things that you're going to do, even non-private practice, that you may end up solo during. So I was full-time in public health, and there wasn't another part-time dentist on with me that overlapped for at least 20 hours of my week. So during oral surgery procedures, these people had maybe nobody in town that would see them specialist wise, because nobody took the insurance because it was Medicaid. So, I got really comfortable and I grew professionally in that. But the more that you can experience before, and then that way you're a little bit more comfortable getting your feet wet in the real world, will truly help you. Not be feeling like you're juggling so many things when you do get out. I did military first, and I would definitely recommend that to anybody. I wasn't what you would say the type. I didn't have it on my radar at all. My aunt made me go and talk to the people at the welcome reception at the beginning of dental school. And I went to the table and I found out what they were offering. And it's really just freedom. It's freedom to be able to commit the time that you owe back, to pay for your dental school, and then be out without student loans, from dental school, which can amount to a lot right now. So depending on where we go in this economy with how we're going to deal with student debt in the future, I have no idea where that's headed right now. But if it remains the same way, that's a really great way to earn that freedom back at a much faster, rate. And during that time, you're getting paid way more than you were expecting, because you're you have everything paid for basically, and you have your health care. It doesn't sound like much whenever you file your taxes at the end of the year, but you'll realize that you have a lot more than you had in dental school. You get used to living on such a restricted income whenever you're a student. So my first years out, I felt like I had the biggest ability to save at that point in time and keep my costs low. So I think keeping your costs, low as far as all your bills that are going out, like try to just moderate what you're purchasing, because the more that you can save then, the better. And if I could have saved a lot more money at that point in time, I would be in a much better position to get a much lower interest rate on a practice loan right now. So there are different ways to go about it. You can go traditional, where you're able to put 20% down, and then you don't have additional, basically, insurance fees on if you would default on your loan that you pay for every month. So if you are able to put 20% down, you don't have to pay those extra fees and extra interest and insurance. But if you don't, you can get a small business loan, so an SBA loan, and it's just it's a way to do it, but it's going to be a little bit more interest in the end. So if I had a way to do that again over, that's definitely some things that I would keep in mind if I were you, even while you're in dental school, or right out of dental school, even getting a job where you're cash flowing. So basically making money, and you have a whole day of patients, and you're not slow. You have a daily rate where you're going to be making a certain amount on salary versus commission. You could be building a practice at the same time, because it takes about 2 years to even build if you buy a piece of land. So those are some things just to factor into your thoughts on how you want to proceed, kind of as you see your future coming together.
Awesome. Thank you. So now we can touch on question number 4 real quick. What are some major decisions that you made on your path to becoming a dentist, and how have those impacted your career in dentistry? Dr. Ortiz?
Hola. Okay. Hi. You hear me?
Yes.
So, what may I? Well, basically, my major decision was I never thought about being a dentist. So I was on the pre-med biology track. I was accepted into medical school. But my brother was a dentist in New York, and I spent a summer with him. And I said, wow, this is great. So you don't have to be in a hospital. You don't have to be, you can be at home during the weekends, enjoying your life. And I so decided that I wasn't that dedicated to be a doctor. So then I switched my path. So I have to, because the admission process has been passed. So I have to wait a year. So I did the whole process again. I stayed an extra year at college, and I was admitted. So basically, it was the moment that I decided to change, and I don't regret it. So being what it's, seeing the news, seeing those doctors, my hats off, those dedicated doctors, being day in, day out, dealing with this crisis. Oh my God, I don't think I couldn't do it. So I think I did a better move.
Awesome. Dr. Mateo?
Yeah, okay. I guess I'd say one thing was just, deciding to do dentistry. Like I kind of mentioned before, I wasn't quite sure until my 4th year of college. I actually considered optometry too, because I had a family friend, and he was a well-known optometrist, and he basically offered me a really good starting salary if I decided to join and become an optometrist. But to me, I was all about, I like the fact that dentistry is very hands-on, that you, like Andy mentioned before, how, you have a bunch of options. You can be a practice owner, you can, work for someone, you can teach, you can do all sorts of stuff. And I wanted to make something of my own, and I think I didn't want to just rely on one person. That's my personal situation, and like if, and I think the other thing was that, it's so hands-on. It's very much, I like drawing, and I like seeing like the results right away. I like the fact that you can, someone's in pain, you can do something about it immediately. Yeah, I'd say that's, in terms of choosing to become a dentist, that was a big decision I had to make, as opposed to, not doing optometry, not doing, I don't know, another sort of health field career.
Thank you for sharing, Dr. Tran.
I looked at my goals in life and wants, and I worked backwards from that. So out of all the medical professions and physicians, you really can't own your own business. I've just been preaching the same thing over and over. You can't really own as an eye doctor, as a pharmacist, as a physician, as much as you can as a dentist. So knowing that I liked the business side and I wanted to control how many days I take off and not be owned by like CVS or Walgreens if I was a pharmacist, or working at a hospital by somebody else, dentistry was my path. And I found that out in high school. So then from there, once I knew that, you can sort of like cheat the system by making sure your resume is tip-top shape for what a dental school looks for. And then from there, everything's pretty easy. So you don't have to do all the other things that some of the other professions might want. So when I went to my school up in Amherst, UMass Amherst, you can double major pretty easily in psych, neuroscience, and bio. Just depending on what school. So obviously, the more things you can put on your resume, the more things it looks better for dental school. So you can put your hours in, you can do all of these extra things. So doing that boosted my resume and made it easier for me to get into school.
And so with that said, I'm sure that this video conference is going to cost or add a lot of points to your resume, people, right? We're doing this because this is going to help you get into dental school, right?
Ideally, the information will be of use to help us get into dental school, but it might be tricky finding a way to write this onto our resumes, although I'd like to.
Well, somebody over here on our side will certainly help you with that, because you guys are like totally on the forefront of this thing, and this is absolutely has to be right up there with shadowing, if nothing else more, actually. So anyway, so to answer the question, really, I was a music major. I knew I was going to have to support myself for some reason. That's just kind of the type A personality I am. And I thought, oh my God, I cannot be a band director the rest of my life. What can I do? So kind of looked at a few things, and I had a roommate at the time that was a physical therapy assistant. And she said, she had some friends in dental hygiene school, blah, blah, blah. Long story short, dental hygiene, 2-year associate program, be your own boss, make your own rules, just like kind of tell the doctor when you want to work, be a bartender on weekends. Hey, that was what I did. I had some great mentors as dentists, and as I hope that perhaps some of us on this panel will be for you. And that's how I ended up even applying to dental school. So the hardest decision was to try to figure out where to go after I got out of school. So there wasn't anything really that difficult. I mean, now it doesn't seem difficult. Every day just seems to have its own little way of making it through. So I think that's all I had to say about that question. Nikki?
Yeah, I'm trying to think of something. I think I kind of shared part of this question the last time. Oh man, I kind of knew. So, of course, they want you to do biology as pre-dental if they don't have a pre-dental program. And my college didn't. And I ended up transferring from a really big college to a smaller one so that I had smaller class sizes because that was just something that I was more used to, I guess, coming from the school that I went to. So I think that one thing that would have helped on the path, though, we at my college, we didn't do a lot of multiple choice. We did a ton of essay in genetics and biology and all of those kind of classes. That's what we did. And it really made me learn the subject, and that was great. But I think that multiple choice is really important to practice, and see a lot more. So I think that would be something that you could, search out a little bit. Another thing is on your resume right now, which I'm sure you're all keeping a list of all your interactions with observations and those kind of things and volunteering. So when you fill out the ADSYS application for dental school, they'll have on there for you to put a description of what you did, like with your pre-dental group that you're doing right now. And you can include this, on your description that you would have Zoom meetings or video conference with, question and answers with dentists in the community. So I think that that's a good thing. I know that I shadowed originally a female dentist whenever I first started observing. And so that was one thing that they told me whenever I went in for an interview that I may be able to do more about is go visit like more women dentists to observe, because they want you to be able to see, I guess, kind of equally women and men in practice. So I think that might be something to consider. Trying to think of anything else. Have I missed anything that you guys can think of? Or any questions?
I think that just about covers it for number 4. So let's move on to number 5 for the time being. So Dr. Ortiz, what kind of practice did you choose after graduating from dental school? And what are some benefits or disadvantages to your choice?
So I joined the Army. So when I graduated, I didn't feel comfortable in going into a practice, and so my original plan was I was going to work with my brother in New York. And I was taking over his practice, but he got sick, and that plan didn't work out. So I have to work. I looked for an alternative one. So, and I saw the Army or the military as a way to get a residency and learn more and have some venture, have some fun before getting more serious in life. So that was my choice. Then when I came back, when I did my 3 years, I worked as an associate for a couple of years. and then eventually opened my practice, that was a great experience. And you learn a lot by wetting your fingers on your own practice. So that was my first probably 10 years. And then the rest we'll talk about later.
Thank you. Dr. Mateo?
Yeah, sure. So right after dental school, I actually did a 1-year residency, AAGD in Arizona. So AAG is Advanced Education in General Dentistry. It was at a Native American reservation. And actually the cool thing about that was that all of the treatment was paid for the patients. So, you know, it was all free for them. So we were able to get a lot of good experience. We had different specialists rotating through every month. So like the first week we had an orthodontist rotate through, then we'd have a periodontist, a gum specialist rotate through, we'd have an oral surgeon rotate, and then we'd also have a general dentist that did a lot of like cosmetic stuff. And he also did a lot of the CAD/CAM, CEREC technology, so basically like milling your own crowns and stuff. I thought that was super helpful for me because in dental school, the appointments are really long, and you know, you're learning so much. There's a lot of red tape. So like appointments are like 3 hours long a lot of times, and you know, you have to get permission from your instructor before you can move forward and stuff. And it gets a little better once you hit 4th year, but you know, it's not. It still was really helpful to have kind of a transition between that kind of environment and then totally being on my own. So in residency, we had attending dentists like there to help just in case, but you know, we were still doing everything ourselves. That's where I first learned how to place implants. That's where I first learned how to take out wisdom teeth and, you know, do kind of some of the more advanced stuff. And it helped increase my toolkit, and then it helped me realize what I like to do, and what I don't like to do. So I thought that was super helpful, and it was really helpful. You know, when I started practicing, my confidence was so much higher. My speed was a lot better than if I had just gone in straight from dental school. And then my first job was actually at a corporate. I can talk more about that if you want. It wasn't a great. I mean, it was a good experience, and I learned a lot. I learned about how I didn't want to do things. I wouldn't want to do things if I was running the show. And then now I'm at another. It's actually technically corporate, but it's a lot better. It's smaller. It's 2 dentists who started it, and I'm actually really happy there. And like I said, I'm happy to answer questions about that. Like, we all have different experiences right now and different paths in our career, points in our careers. All right.
Right on. Thank you for answering that. Dr. Tran?
So I actually wanted to specialize after I finished dental school. I wanted to be an orthodontist. I wanted to place brackets. I wanted to have my assistants help me with a lot of stuff and just check for 2 seconds and then walk away and collect thousands of dollars. That was sort of my thought. So I got the grades, and then I was going to apply, and then I didn't apply. For me, time is very important. And as of right now, I'm going to be 30 this year. So every step that I make, I try to buy time, because if you listen to the really thoughtful people, no matter how much money you have, you can never get your time back. So with that thought process in mind, I didn't think it was worth my time to only be able to do braces and Invisalign and clear correct for the rest of my life. I could still do all of those procedures as a general dentist, as long as I can do them to the standard of care. And so instead of going to additional 2 to 3 years of school after finishing dental school, I went straight ahead and start learning about the things that I wanted to learn, which is that, but it also included everything else, so I could dabble in whatever I wanted.
Excellent. I ended up getting into an associateship, which back in the day, I graduated a long time ago, GPRs weren't really the big thing then, but it was if you could get in with a great doctor that needed somebody to help with their practice, they would act as a mentor. And so literally I had 5 years in Houston as my own personalized GPR as an associate. What happened there is that wasn't exactly the best part of town, and I knew that I wanted to live in Austin, and life was changing, and I was going to want to raise my kids in Austin, so that's where I ended up finding a practice, which I finally bought an existing doctor's practice, where I've been ever since, except I jumped across the street and built a building. So I can't tell you about the other disadvantages or advantages of, corporate or what, I don't know. I'm a general family practice dentist, but organized dentistry and continuing education are your friend. So once you get to dental school, once you get through dental school and you think you know everything, just remember that you don't, and that all the CE, especially now, and I don't know, maybe Luis, we could hook them up with some of these courses, these CE things that some of the guys are doing. Maybe we could forward that to one of the guys, that they could forward to others to kind of look and see what we're looking at during this time, because right now it's very interesting in how much our community is sharing. There are consultants and groups that are doing CE, and they're literally throwing all this stuff out there at no cost, and they're sharing it with all dentists, not just the people that had signed up with them as consultants. So let's put that on our list if you guys think you might be interested, to forward maybe a couple of those things so that they could see that. Okay, that's it.
Thank you. Dr. Madison?
Okay, so I went into the military, and fortunately in the military, you have a set amount of money that you're going to take home, regardless of what you produce. So just because you come out of the gates slower than you would after 5 years of practice, you're not making any less. So I think that that's the major advantage and the benefits of that, with having health and all those things also included. It also allows you to rotate through to specialty specialists, to learn from them. So I was able to go into any specialty office that I wanted on the installation and get taught by the specialist anything that I had questions on or I wanted to get credentialed in, and do them at our installation. So depends who's supervising all of that and what the regulations are, at your installation. But that's something that you might have some freedom to do there. The cons behind military are moving every 4 years or 3 years, and you can't wear earrings. For women, having to wear that outfit and not wear earrings and your hair back all the time, it just kind of felt a little dehumanizing, or you just didn't feel like a girl so much whenever you're doing your Monday through Friday. But other than that, I would say, there's one thing that in private practice, even now, whenever you get out, it's a lot of times by commission, like how much you produce. And if you don't go into a practice that's going to keep you busy, you may, be limited on how much you're making every month. So I would just always kind of keep that in mind and talk to us more, as you kind of get into those situations and consider getting out and the kind of contracts that you're going to be seeing, which I think we could all probably look over for you. But that was my experience.
Thank you, everybody, so much for sharing. So for the sake of time, to make sure that anybody who has a question has the opportunity to ask that question, we're just going to put a pin in questions number 6 and 7. So if anybody has a question that they'd like to ask all of our speakers today, please feel free to post that in the Zoom group chat. Anything like a specific question for a specific dentist, we can do towards the end of the meeting. So if anybody has any general questions, please feel free to ask those now in the Zoom chat. And then in a minute here, Dr. Ortiz will pick 1 or 2 that everyone can respond
I
to.
would like to go ahead and answer question number 5, because that was a very, very significant and it pretty much changed my career. So when I joined the military, I did my 3 years, and I also did a master in public health. So I went back to my hometown in Puerto Rico, and I established my practice. And for almost 10 years, I was having a great practice. I got involved with AGD, become a master, a fellow, a master. I have an office. I remodeled my office. I invested in taking an implant sedation course, and I remodeled my practice, and I was set to start doing implants and sedation in my practice. But things changed. So one of the things that my master in public health gave me was a vision and a real more understanding of how the healthcare system works. So back then in Puerto Rico, they have a social medicine, and it was a good thing at the beginning, but I realized that once the patients get all their work done, the maintenance phase wasn't that productive. And with all the political changes and the economical issues that we're having back then, so I started checking that I was subsidizing my practice, and basically the hairdresser next to my office was making more money than I. And so, and I have, but back then I have two young kids, and I have to make a decision. So I either gonna spend my whole life working here and not making money, or I have to make a radical change. So I went to Arizona, Florida, but Texas, you got the license by credentials, and I took the advantage of that, because no way I was gonna take in another board. I was gonna do another class 2 in my life for being for credentialing. And so I moved to Austin, and I didn't know anyone. So that was like a blind jump, a leap of faith. So, and I couldn't open my practice because back then I have to provide money for my family. My family was first. So, and I ended up doing a lot of bad and good associate jobs. And so one thing that helped me getting through was being part of the AGD. So I met people, I met Anne, I got involved, and I got involved in organized dentistry, and I thought I was gonna be a leader, and I didn't know that part of me was there. And so I met just a significant amount of great people. They are my friends. We have fun together. We love dentistry. We share our tribulations. And another thing that I've been doing is I got involved in education. Remember the first part that I wasn't even paying attention to academics, but now I'm paying attention to that. And I decided to be the best dentist that I can be. I don't even got the master. I got the long life service recognition. I'm starting to be board certified. Don't ask me when I'm doing this, but it's addictive. So my being said is sometimes you have to you have to follow your instinct, and you don't know what you're gonna get on the other side. But in my case, it was worth it. I'm here in Austin, happy, and enjoying my life and raising my boys here. One is I'm so proud of my Longhorn son, and as I say, at the end, everything worked out, and I'm so happy and so proud to be here and sharing my experience. So, Min said that on me, you have a friend that anytime, anything you need, any advice, I'll give it to you.
Thank you so much for sharing that. So I see we've got a few more questions in the Zoom group chat. So if Dr. Ortiz, if you see any that you think would be a good jumping off point for the other dentists to respond to, or if any dentist speaker sees a question that they would specifically like to respond to, now's a great time for that.
Though there was a question for Dr. Mateo, so it was on the chat. So Dr.
Okay,
Mateo,
I'm going to read that out just in case anybody can't read it. It says, Dr. Mateo, could you elaborate more on why your first corporate dentistry experience was not enjoyable?
Sure. Yeah, definitely. One of the main things was I didn't have control over my schedule, or I guess the supplies and everything, just the way they ran the office. I really didn't like being slammed with certain procedures that I felt like should have been spaced out differently. It just really, to me, it affected the quality of the dentistry, and it was going to be either affecting my quality or I was going to be behind schedule. They were very much more money oriented. I mean, it's a business, so at the end of the day, of course, you got to keep the lights on, and you do want to profit. But I just felt like the culture and everything with regards to how they handled it was, in my opinion, it could have been done a lot better. I mean, that's the advantage to owning your own practice for sure. You have control over, how your schedule is going to be, what procedures you do, how you're going to do it, what materials you use, what techniques you use. You don't have to. It's not going to be dictated to you. The contract too. That's one thing I do regret as well. I should have been a lot more careful when I was reviewing it. It's something I learned though, and with my next job, it's a lot better. That's something definitely, I think Nikki might have mentioned it. A lot of us could help you when it comes to reviewing contracts and when the time comes. But that's something that I was not even looking at, even the compensation package, just a lot of different things, the amount of days off that we were allowed. Oh, yeah. There are a lot of things wrong with practice, in my opinion.
Thank you for sharing. Let's see here.
Oh, Bennett, there was a question about balancing life and dentistry. So
perfect.
Andy, you would like to go ahead and give this your thought now that you're an entrepreneur?
I'm 100% type guy, so I'm not really much of a balance. If you ask any of my friends, we try to balance it by scheduling out. So I don't know if anyone does this, but I just learned this from, if anyone heard of like Tim Ferriss or Gary Vee or anything. So basically anything that's in your calendar gets done. If it's not in there, it doesn't get done. So we literally schedule our holidays out. We make a trip to see our friends once a year. We make a trip to go camping once a year, and we invite certain people that we want to see. And then we have certain vacations we have with our families. And once all of that's filled up and we know these are the days and these are the times and these are the flights, most of the other time and the other things I'm doing is for what I want to do. And what I want to do now is to grow this business as much as possible.
And we would like to hear from you. You were open your practice and you raise your boys in Austin. So can you tell more about your experience?
Well, briefly, I know these guys are like going to have to get into dental school. So I'm going to tell you this right now. You guys think that you know a lot after getting through your undergrad, but I want you to take any dental admission test courses that you can possibly take so you can ace it on the first try. It's a waste of time and money to do it more than once. That's one of the first things. The second thing is that once you're in dental school, you know, some of us are going to have to work. Some of us aren't. You guys are going to come out with a whole lot more debt. Don't let that worry you. People will always lend you money as a dentist. Doesn't matter even if you have a job. So don't worry about that. After that, get through the school, get through your state board, or now whatever they have, reciprocity, thank God for that. And just get through that part and figure out where you want to live. And that's the main thing. And travel around a little bit. You guys have time. Figure it out. Don't just like plant yourself in the first place that comes across. And that would be my advice to you guys. Just one bite of the elephant at a time, as Linda Miles used to always say. She's a consultant. She's still alive actually, but she's a consultant from days gone by. And with that said, I would definitely always hang on to your mentors, hang on to anybody that can give you any advice, and we're here for you. And thank you for inviting us, by the way.
Thank you guys so much for coming. I want to say one thing real quick is I know we just passed the hour mark, so if anybody does need to go, please feel free to do so. We really appreciate you carving out this time in your schedule. But if nobody is, if you've got nothing else going on and we do have some more lingering questions in the chat here, so it's up to you guys. But thank you so much for coming. If you need to go now, that's totally okay.
Bye.
Bye. I want to answer, somebody asked about public health, and I'm sorry if my phone dies. I'm hoping it will hang on. I tried to plug it in. So somebody asked about public health and kind of what to look for, what's some of the good and the bad. So I would say you could definitely make a career out of it. Hazel, stop. My dog is squeaking her toy. So, you know, I would pick very carefully because the administration, you can't make a lot of changes very easily sometimes in public health because you might be limited on budget, and you're also splitting between a lot of different like specialties. So you might have, you know, pediatrics and obstetrics and mental health, all the, you know, eye stuff. So you might have all these different specialties in that public health company that you want to work for. So public health is technically anything that is federally and state funded. If you're doing like Indian healthcare, that is also, I think, public health. But the administration, how that runs would be my number one thing that I would want to know. Is there a dental director? There should be a dental director. They're the ones that would at least have quality assurance checks, making sure that we're doing chart audits, reviews, you know, for employment for the staff, which is really good. And then some of the staff can sometimes not be the most qualified and most experienced because they might be paying them less than what they would get in private practice. So, you know, it just kind of depends where you go. If you can foster a really good culture in the office, I think that you can attract and keep wonderful people that do have great hearts. But you do see some of the worst cases, I would say, as well in public health. So it might also be an emotional type of job where, you know, you see foster kids that have been sex trafficked with their foster parents. And it's a very tricky, you know, situation with that, always making sure that everybody feels safe at home. is something that we ask just because it tends to show up more in the Medicaid demographic too. And then, yeah. So does that answer your question about public health? Okay.
I can answer the question also. I think Nathan asked me about what Colby was asking. Oh, did you find it? I found my spouse in dental school, but she wasn't in when I was in dental school. She's not a dentist though. I actually did long distance with and she's now my wife, but at the time we were doing long distance, I was in Boston, she was in California. And I also, there was a lot to balance actually during dental school. I worked the first 2 years. I was teaching the dental admission test, the DIT for Kaplan. And then, it was pretty tough, I'd say, but basically just don't sleep that much. You kind of choose, there's only so much time in the day. It's like you want to keep your grades up and have a relationship. You can do it, have a relationship, stay in shape, and then work, but then you kind of have to sacrifice somewhere. And for me, that was more sleep. So,
So one advice that I would like to get you, to get into, present yourself as a better candidate for admission. So these days, you all have the benefit that you can combine your undergrads with anything you want, and as I said before, dentistry is very diverse, and so just find something that you would like to do. Like, for example, if you have interest in being public health, do something public health, do some research. It won't hurt if you would like during the summer go into a dental lab and work and observe and enhance your skills. So, and those things, they're gonna, believe me, they're gonna work for good while you're in dental school. So for me, it's the scientific part, the sciences, it's not that hard. What is really hard is that, for me, when you get into your skills, when you have to work directly with a patient, so that relationship, so it's something that you have to develop. So the more things you can get involved and mix with that, it will present you better as a candidate. And once you get into dental school, so don't forget the Academy of General Dentistry. We have dental chapters that are very active, and we provide dental education. And once you graduate, you can apply all those credits for being a fellowship and become a leader. Believe me, our organization is one of, if not the best in organized dentistry, because we care for general dentistry, even from dental students, for people who were thinking about being dentists. So join the AGD and you won't regret.
Another thing I wanted to add, you had asked what the most difficult part of the journey was. And I would say part of what I would say was the hardest part is where you guys are at right now. Studying all the different courses that you don't necessarily think that you're going to use or want to do or have any interest in, just to complete your major and your requirements. And I think that was probably the hardest part for me, but it will discipline you in doing all of that in the course of time. So I call it jumping through hoops. And unfortunately, life is constantly just hoops. But I feel like undergrad, you had to jump through so many hoops. Then you get into dental school, and the first 2 years they're jumping through hoops. I would say that the last 2 years of dental school are a lot more fun. The hoops that you're jumping through are still frustrating, but they're frustrating in a way that is very minimally temporary. So I would say congrats, to how far you've made it even thus far. I know that this is all a really stressful time, and to take myself back to where you are right now, I can tell you it's a lot more stress for me having to do the reading and writing and all the exams that you're doing right now on the subjects in undergrad. But just feel like you got part of it behind you, because you do.
Thank you so much for answering. If we've got any more questions in the chat that anybody would like to answer specifically, otherwise we'll shoot to wrap up here in a few minutes, around 8:45 or so.
So, well, Ben, I would like to finish with the last question about corporate dentistry. So, unfortunately, is a necessary evil that it's going to stay and it's going to grow. And even more after what we've been through. So, one of the things that when you get into dental school, there's a lot of debt involved, and you need to work. And most of the times, those are the places that you can easily find a job. So, but not all of them are bad. Well, I would say them. But as long as you keep your ethics and your desire to be a good dentist, you're gonna find some good corporate groups.
Awesome. And I see we have another question about how did you make yourself a standout applicant for dental schools? To all of our guest speakers, did any of you guys do anything that you felt really helped you in your application process?
For me, it was the DAT. That really helped me because I'll be completely honest, my GPA wasn't the best. My first 2 years I wasn't focused, let's just put it that way. Second 2 years of undergrad, I decided, I got to do something with my life, and my I had an upward trend on the GPA, but DAT helped me a lot. I mean, of course, there's going to be the extracurriculars too, but I really think that's what got me in.
Awesome. Would anybody else like to comment on that?
Yeah.
I think.
Hear me?
Mm-hmm.
Good. I'm trying to send it in my chat, but I was saying forming relationships with the dentists that you observe, and then also all the different specialists, and then a lot of volunteering. I mean, you can really fill up a resume if you just do things even once with an organization, whether it be like volunteering for the Susan G. Komen breast cancer run that happens one day a year, and you just do the volunteering thing. I think that you'll realize there's a lot more that comes out of volunteering at that one time. I met somebody who lived across the street who was pre-dental in undergrad, and I was in dental school at the time. Come to find out, we were an hour away from our neighborhood, and we happened to live across the street from each other, and want to be, doing the same thing when we got done with all of our schooling, and just in different places in our lives. So the people that you meet are going to provide some really great connections, and usually be some really good people in the community too. So I would say volunteering is a great thing to round out your resume, along with forming those relationships and kind of putting in a lot of time whenever you're observing, and making it very diverse too. I don't know if you guys know this, but my friend is in a residency up in Minnesota doing orofacial pain, and it just got announced as the 12th specialty in dentistry this past week. Maybe it was Monday or Tuesday. So, that's something else to check out if you can find a provider, in wherever to observe that.
Awesome. Thank you guys so much again for giving us this bit of your schedule today. This meeting as well will be posted online for our members to look for some of the members that weren't able to make it tonight. So I just want to say thank you again for making this time for us. And with that, I know we've overstayed our welcome a little bit. So I'm going to go ahead and end the meeting now. So thank you guys again.
And thank you.
Thank
Good
you.
luck, guys.
Thank
Take
you
care.
for having
Thanks,
us.
guys.
Wash your
Yep.
hands.
Everybody.
Good luck.
Take care.
Bye. Thank
Bye.
you.
And if you guys have other questions, you can feel free to reach out to me. I'll put my email in the chat. I don't mind. I'm not really doing much anything right now. See you guys.
Guys.
Thank you.
Well, it's just members now, so what's up?
All right, Jeff or Andy?
That's a good question.
I really want to hear that life story, but that's fine.